Hello students, I am Dr. Praveen Tripathi, Faculty of Psychiatry, and since the results were announced, a lot of you have been messaging me. You want advice about psychiatry, whether you should take it as a branch in PG or not. So I thought I would make a quick presentation and I would try to answer your questions. So I am trying to cover the most frequently asked questions about psychiatry, some of the good things about psychiatry as a branch, and some of the bad things about psychiatry as a branch. So let us start with some of the questions that students commonly have about psychiatry. Alright, we will go by these questions one by one. The first question is, who should take psychiatry? Is there an absolute contraindication to psychiatry? The answer is yes. I would strongly advise you, and not only me, most of the psychiatrists would say that take psychiatry only if you really like it as a branch. Psychiatry is not like any other medical branch. For example, whether you like it or not, if you take medicine, you would kind of be okay with it sooner or later. But psychiatry is a branch which may kind of generate extreme emotions. Either people love it like anything or people hate it like anything. So you ensure that you like it. Now you don't have to be in love with the branch. It is okay if you have some amount of liking, because your liking would grow as you become a psychiatrist and as you progress further in your professional life. But if you dislike the branch, don't take it just because it is available. This is something that I would stress upon, that if you have never liked it, if you can never understand what is going on when you read about psychiatric disorders, do not take it just because it is available. But if you like it, or if you have some amount of affinity towards it, it's something that you can take. Alright, this was the first question. The second question is, again, something very commonly asked. Do you have to be a saint? Do you have to be a very calm person, very composed person, a very patient person to take psychiatry as a branch? Well, the answer is again yes and no. Now, contrary to the popular belief, you don't have to be an extremely patient person to practice psychiatry, but there has to be some amount of patience. Now, if you are a person who dislike talking, if you are a person who just cannot have a conversation, if your attention span is less than 2 minutes, then probably psychiatry is not the best thing for you. But if you are like a normal person, can have a concentration of 5-10 minutes, can engage with a person for 5-10 minutes, then that is enough for taking psychiatry as a branch. Now again, when we think about psychiatric sessions, or when we think about psychiatrists seeing patients, sometimes we have that image of the doctor and the patient sitting together for hours. Now that rarely happens in the clinical practice. Even for a psychiatrist, if we are talking about normal consultations, they rarely go beyond 15 minutes or 10 minutes or 20 minutes in certain cases. Only the sessions are longer, and again in real world, in real practice, most of the psychiatrists do not do sessions. They mostly do the medical treatment. Good number of psychiatrists do sessions also, but then they are separate, right? So it's not that you have to be an extremely calm person. Anybody can become a psychiatrist who has the basic skills, which most of you do have. And the important thing is, these skills you develop as you continue with your residency. It is not that you have to be born with them, but like any other branch, you also develop these skills when you do your residency. So again, you don't have to be cool as a cucumber to do psychiatry. Anybody with some amount of patience, some amount of calmness, some amount of communication skill can go into this branch. Alright, the third question. Alright, so I have kind of answered it already. Does the practice of psychiatry involve a lot of counseling sessions? So most of the psychiatrists, when they start their practice, they do a lot of counseling sessions, primarily because they have a lot of time. But as you become busy, you as a doctor, as a psychiatrist, start cutting down on sessions because of the paucity of time. In real practice, sessions are mostly done by clinical psychologists, but that's not an absolute rule. Many psychiatrists love doing clinical therapy sessions, love doing psychotherapy sessions, and it is a matter of choice. But for most of the psychiatrists, it becomes difficult as they grow in their practice to do therapy sessions. So therapy is mostly done by clinical psychologists who usually are attached with a psychiatrist. Alright, after this, the fourth question is, alright, this is a good one. A lot of students are concerned that if I become a psychiatrist after some time, would I myself develop some kind of psychiatric disorders? Some students are quite frank. They say that, sir, I have heard that psychiatrists go crazy after some time. So does that happen? Well, I do not think so. I don't think that psychiatrists develop psychiatric disorders because of seeing patients. Psychiatrists, in fact, any other doctor, in fact, anybody in this world can develop a psychiatric illness. Depression and anxiety are extremely common. So you are also a human being, even if you are a psychiatrist, and you are also equally susceptible to development of depression and anxiety. So that can happen, but not because of seeing the patients. One thing is that when you become a psychiatrist, it becomes much easier for you to diagnose yourself. So if you are a psychiatrist, even if you have some symptoms, you would be able to catch it quickly, and probably that might increase the chances of you self-diagnosing because you know what is going on with you. That is one reason. There is some hypothesis also that people who go into psychiatry branch, they often have some family member or some close relative who had a psychiatric illness. So they have seen the psychiatric disorders firsthand, and that is why the fascination with psychiatry. Now there is this hypothesis, again hypothesis, not a theory. A lot of people say that, not conclusively proven, but either way, just because you are working with psychiatric patients, psychiatric disorders patients, does not mean that you will develop a psychiatric disorder. I mean, it's like somebody saying that if you become a cardiologist, you are more likely to have a heart attack. Doesn't that work that way? I believe the more valid thing to say would be, if you're a psychiatrist, you would be able to catch anything if it is happening with you more quickly. So no, you don't become crazy if you become a psychiatrist. Next question is, what about the super specializations? So are there super specializations available in psychiatry? The answer is yes. A lot of institutes are offering DM nowadays. So you have got DM in geriatric psychiatry, you can do DM in child psychiatry, you can do DM in de-addiction. AIMS is offering it, PGI is offering it, NIMHANS, the topmost psychiatric institute in the country, it offers DM. It also offers fellowship, 1 year fellowship in many fields like child psychiatry, OCD, schizophrenia, I believe consultation liaison psychiatry. So all those super specializations are available. The number of seats are still very less. So that is a problem. Even if you want to do a DM, the number of seats available are very less. Another important thing is that whether doing a DM would give you any kind of benefit over the other person who is just a MD psychiatry is still questionable. So say you do a DM in geriatric psychiatry, would you have any kind of advantage over MD psychiatry? That is questionable. Unless you want to go into some kind of academics. So if you want to go into academics, definitely DM would help, but otherwise it's unlikely that it would help you in the current context. Nobody knows what happens 20 years later, but as of now it is not really giving you an edge. Although child psychiatry is something which gives you an edge. There is a lot of demand for child psychiatrists. Virtually there are no child psychiatrists in the country, very few of them. So if you are able to do child psychiatry, that gives you an edge. But then child psychiatry comes with its own problem. The practice of child psychiatry requires a lot of patience, a lot of skills, and the number of patients that you can see in a day is quite limited if you want to do a good practice. So there are the pros and cons of doing child psychiatry also. But as of now, I would say specializations are available, but as of now there is no clear-cut advantage of doing those except in child psychiatry. Alright, the next question is, what about going abroad? Alright, so that is very easy if you do psychiatry as a post-graduation. So going to Australia is pretty easy. You just have to pass an English exam, and also United Kingdom. I mean, even we people keep on getting mails every couple of days from NHS, people from NHS. They want Indian psychiatrists to go over to United Kingdom, England. So if you want to go to Australia, if you want to go to UK, it is pretty easy. A lot of my friends, a lot of my seniors and juniors have gone abroad. But again, why do you want to go abroad? That is a big question. And if you want to go abroad, why do PG from India? Why spend 3 years if you only want to go abroad? You can do it beforehand, you can do it after your MBBS. So that is something that you have to think about. But yes, statistically, it is pretty easy to go abroad if you are a psychiatrist. Alright, after that, what is the scope of psychiatry in metros versus smaller cities? Now that is a question that a lot of people ask. So before making this video, I called up many of my friends who were doing their practice in smaller cities, tier 2 and tier 3 cities. I myself work in Delhi NCR, so I know a bit about what's happening in the bigger cities. Now the scope of psychiatry as a branch in metros is pretty good. So a lot of us got into private practice in last 5-6 years, and I do not know anybody who is struggling. All of my batchmates, all of my colleagues, all of my seniors, all of them are doing pretty good, who are located in the bigger cities. So Delhi, Bombay, Bangalore, Hyderabad, Chennai, Kolkata, all these big cities, people are doing pretty good. Now, as far as the practice of psychiatry in metros is concerned, it is also good because educated people are there in metro cities. They know about psychiatric disorders, the stigma is going down, and they are more likely to see a doctor. So it's pretty good. But when it comes to the smaller cities, so I talk to people who are based in Bhopal, Indore, Allahabad, Mangalore, so smaller cities in comparison, tier 2 and tier 3 cities. Now the practice of psychiatry in these cities is also pretty good. All of them are doing wonderfully great in their careers. There might be some difference. For example, in smaller cities, say a patient develops psychosis or schizophrenia, to be more precise, he is more likely to go to a neurologist first or a neurosurgeon first, because that is what he is aware of, and from there he might be referred to you, the psychiatrist. The practice of milder disorders like anxiety disorder may not be that robust, but overall the practice remains good. So if you have an apprehension that you belong to a comparatively smaller city and you are apprehensive whether you would be able to practice psychiatry properly or not, that's just a misconception. Everybody is doing good. Now some amount of this pessimism about psychiatry also stems from the fact that like 25 years back or 20 years back, psychiatry was not a preferred branch. People used to avoid it and they had to pick it rather than picking it by themselves, and that is why probably they carry that kind of pessimism about the branch. That is why sometimes you guys feel that the professors of your college, the older ones, they are a bit weird, strange, but in the last 10 years or 8 years or 5 years to say, things have changed a lot. When I was in MBBS, this is something that happened like 15 years back when I was starting with my MBBS. We used to say that psychiatry is an upcoming branch, but we don't say that any longer. Already psychiatry has made progress by leaps and bounds, so it's no longer upcoming branch. It is already there. People are doing pretty good. So whether you're in a big city, whether you're in a small city, it doesn't matter. Alright, finally, what about the research opportunities? Now, I don't know how many of you are interested in research, but I'm sure some of you are. So, psychiatry is still a nascent branch. We know very little about the brain. Not only psychiatry, even if you talk about neurology, we are struggling. Even in neurosurgery, we are struggling because we don't know that much about brain per se. We know the heart in and out, but brain is much more complicated. So, a lot of research opportunities are there. Psychiatry, medication, psychopharmacology, the medications of psychiatry have improved a lot in the last 30-40 years. They would keep on improving. A lot of things are happening in the pharma companies. A lot of things is happening in the pure research. So opportunities are there. In our country, not so much, mostly in NIMHANS, Bangalore, a bit in AIIMS and PGI. So if you are really into research, probably going abroad might be a better thing to do at this point of time, or else go to some of these premier institutions, primarily NIMHANS. NIMHANS is doing some great work, so that is one place where you can go if you want to do research. So these are some of the FAQs, commonly asked questions that students have. Let me talk about some of the pros and cons of psychiatry. Alright, let's talk about the good things first, pros. The first thing is, of course, better work-life balance. Emergencies are usually not there. In your residencies, if you are working in a big hospital, of course you would do emergencies, but once you get into practice, very few people work in the emergencies, psychiatric emergencies. Very few institutes in fact have psychiatric emergencies. So you are able to go to bed at the right time. You don't have to do night duties. Those things really help. Apart from that, 24-hour duties are kind of non-existent once you are done with your residency. So again, that is something that is advantageous. Also, I believe that when you practice psychiatry, you can limit the number of hours. For example, most of the people around me in Delhi NCR, they work for like 3-4 hours in the morning shift, 3-4 hours in the evening shift, and do pretty good. So because it is primarily an OPD based branch, you can kind of call the shots. You can choose whatever you want to do. Apart from that, this is another interesting aspect. When you do psychiatry, you get to learn a lot about stuff. I mean, you go beyond the medical education, you start thinking about other things. So the thinking might kind of become broadened, and you might actually start liking other stuff like psychology and the behavioral sciences and other things you become interested in. You understand yourself better, you understand people better, you tend to become more calm, more mature. So all those things are added advantages. I don't know whether you care about them or not, but that happens almost with every psychiatrist. All right, the good thing is the demand for psychiatrists is increasing with every passing year. It's still a branch which is yet to come to its full-fledged form. The number of patients is huge. The data says that almost 10 to 15% of people would have at least one psychiatric disorder in their lifetime. That's make a huge number. Till now, people were not aware of psychiatric disorders, or there was this crippling stigma, but things have changed a lot. With all these Bollywood celebrities coming out and saying that they had depression, they took medication, all these sport person, all these Hollywood celebrities. So those things have helped a lot in breaking the stigma, and we often see that people are more than happy to talk about these stuff. In fact, I'll tell you a personal story. I had gone to a party of a startup guy. He was a friend of mine, a big shot guy. So I went to that party, and I saw the CEO of one company that I was dealing with. He was a CEO of a financial company, and I wanted to talk to him, but I did not know how to do it. So I just went to him and I said that I'm a doctor, and he was not so interested. He did not really talk to me much, and after 5 minutes I thought that let me say something more interesting, and I said that, well, I'm a psychiatrist. And once he heard that I'm a psychiatrist, his tone suddenly changed. He became very interested, and he talked to me for the next 1 hour. Typically the thing that everybody needs a psychiatrist, and how to rear the child, all those stuff people become very interested in. So there was a time when people would become uncomfortable when you would say that you are a psychiatrist. From there to this situation where saying that you are a psychiatrist actually makes people curious. The society has come a long way, and so this is one example how stigma is decreasing and how people are becoming more and more curious about this branch. So the demand would increase, and in our lifetime it would keep on going up. The demand supply gap continues. The number of psychiatrist seats have increased, but still there is a huge gap. There are many districts in the country, many small towns in the country where there are practically no psychiatrists. So the demand supply would remain skewed towards the professionals in the years to come, which is a good thing. All right, now this is interesting. I don't know how many of you are aware of this, but in comparison to other branches, psychiatrists tend to have an early settlement. Some of it is by choice, some of it is forced. I'll talk about that in a short while. But most of the people after their PG, if they go into private practice, within 2-3 years, most of them start doing decently well, and yeah, so settlement is early in comparison to your batchmates who would be doing the super specialization or fellowships. By the time they come back and by the time they start practice, it's possible that your psychiatry colleague would have already established his practice. So the settlement is early. All right, so this is something important. Now say you have a friend who's an ophthalmologist, and if he wants to start a center, he would have to make a huge amount of investment. Now we doctors usually don't have that much money. We usually belong to middle class families. Now this is a good thing about psychiatry. If you want to open a center, all you need is a couple of chairs and tables and a place to rent. So investment is pretty minimal. And the second point is even more important. Psychiatrists are flourishing as individual practitioners because psychiatry is still kind of out of the reach of corporates. Now all these big corporate hospitals, Fortis, Apollos and Max, all of them do have psychiatrists, but their focus is not on this branch. primarily because the admissions in psychiatry are minimal. So probably that does not make much sense to the corporates, and that has an advantage for an individual practitioner, because you are not competing with these big brands. You still can flourish in your practice. So that is one very big advantage about psychiatry. A lot of people don't appreciate that, but it's a huge plus point. All right, again, migration. Well, I am not personally a fan of migration. I don't see a reason why anybody should migrate from a country like ours, which has got huge opportunities for everybody. But if you want to migrate, if you want to go to Australia and England, as I said, it is very easy, much easier than any other branch. Let's talk about the cons. All right, so everything comes with its own problems. The biggest problem that you will face with psychiatry is stigma. Try telling your parents that you want to do psychiatry, take psychiatry in PG, and in all likelihood you would face resistance. The reason is that your parents also carry the same stigma that the society would carry 30 years back. Your parents are thinking what used to happen 25 years or 30 years back, and it is true that 25 or 30 years back psychiatry did not make that great a choice, but things have changed, right? So stigma would be there. Your parents would not agree when you tell them that you want to take psychiatry. Your friends also might dissuade you, because they also have heard things from people. Who these people are, nobody knows, but there's a lot of negativity about this branch. But I assure you, it is all hearsay. None of those stigma really exist. Yes, patients also do have stigma. Patients are at times not willing to go to a psychiatrist, fearing stigma. But even if you take care of those numbers, that percentage of patients who are not so willing to meet a psychiatrist, still the number of people who are willing to meet a doctor is humongous. So it's not that big an issue. So the first con is stigma. You would face it. The second problem comes when you enter the branch, when you take the field. Now I'll tell you something about myself. So I always wanted to take psychiatry. I took psychiatry with I was very happy when I got psychiatry. I was doing it from Hibas, Delhi, one of the most premier institutes for psychiatry. By the time I reached my second year, I started hating it. I felt that I took a wrong decision, and not only me. Most of the students who take psychiatry in PG, at some point of time they feel dissatisfied with the branch. The primary reason is that when we are doing MBBS, we are talking about the receptors and the pathology and the mechanisms, and we are extremely biological in our approach, that this is what causes this receptor, we give this drug and this works like this is the mechanism, and this is the way we think. And then you start talking to people. I mean, I remember sitting in one of the OPDs in my second year PG and talking to somebody about some psychosocial issues, and after the session I felt that what the hell was I doing? I'm a doctor, I'm not supposed to talk about how's your mother, who all live in your family, and what is the financial support. I thought that this is not what doctors do, and I felt very dissatisfied with the branch at that time. So this is the reason why many people feel during PG that they are not being doctor enough. You start missing the stethoscope, but that is something that goes away after some time. Once you enter the practice, you realize that psychiatry is as medical as any other branch. You rarely talk about other stuffs. You are focused on the disorder, the management, and getting your patient better. But even if you, but this is something that is likely to happen. If you take psychiatry, it is quite likely that you would have days when you would feel frustrated with it. Just let it be. Just let those days pass, because they do go away. All right. So jobs. Now jobs are a problem in psychiatry. As I said, that corporate is still not so much interested in psychiatry for reasons which are good, I believe. But that creates a problem. If you are a guy who wants to do job, you would struggle. The jobs are almost non-existent. Government sector, you know how many jobs are there. There are very few. And if jobs are available, usually they are with some senior psychiatrist who would not pay you much, and who would in all likelihood not allow you to grow much, of course, for obvious reasons. You may get absorbed into the hospitals, but they would not offer you salary. They would pay you according to the number of patients you see, which would be very less in the beginning. So if you are a person who wants job per se, you would struggle. But I think it's a good thing, because jobs are not available. People go into their own practice and they establish their practice. So I think it's less of a con, more of a pro. We talked about it. The super specialization is pretty limited. Seats are lesser, and most of you would not be able to super specialize. And again, I feel that it's not a problem. As of now, even psychiatry needs to be absorbed more. So the super specialization really adds an advantage to your profile. So these are the pros and cons of psychiatry. In toto, if I look at it holistically, I think it's a pretty good branch, and I'm trying not to be biased here. That is why I talked to a lot of people before making this video, and whether they are practicing down south in Chennai, or whether they are practicing in Punjab, everybody looks pretty happy. I think don't let the stigma come in your way. If you really like psychiatry, go ahead, go for it. Even if you have to face a bit of resistance from your parents or family members, still go for it. I'm sure it would pay rich dividends to you. You would not regret it. I hope I was able to tell you some important stuff about psychiatry, and best wishes. Take care.